And so I'd like to introduce now Dr. Charles Macias, who's a co-PI of the PPN. Dr. Macias is the Chief Quality Officer, Vice Chair for Quality and Safety, and the Division Chief of Pediatric Emergency Medicine at the University Hospitals, Rainbow Babies and Children's Hospital. Dr. Macias will serve as the moderator of a series of talks on pandemic policy. Thanks.
All right, so it's certainly my pleasure to serve as moderator for this segment of the program on pandemic policy. I'd like to thank the organizers of this conference, as well as our pediatric pandemic sponsors through HRSA. All of our speakers have had significant influence in preparedness and response activities during the pandemic and the ensuing surge of pediatric viral illness, subsequent ED visits, and peaks of hospitalizations in mid to late 2022. Each brings a very different perspective on the implications of pandemics and the surge and what it means to the U.S. healthcare system in terms of lessons learned and best practices. That all said through the lens of the Pediatric Pandemic Network, you'll hear a lot more about today. After each of our focused presentations today, there'll be a brief period of question and answer, time permitting. However, if we don't have time for your questions, please save those to the end, where we'll ask all of our presenters to come back up on stage, and we'll be able to lead a question and answer session from 11:30 to 12 today. So our first framing discussion will be presented by Dr. Mark Batshaw. Dr. Batshaw is a neurodevelopmental pediatrician who served as the chief of the Division of Child Development and Rehabilitation Medicine at the Children's Hospital of Philadelphia. After a decade, he was recruited to Washington, D.C., where he served as chairman of pediatrics and associate dean for academic affairs at the George Washington University, and chief academic officer and director of the Children's Research Institute at Children's National. In 2015, he was appointed to the role of physician-in-chief at Children's National. Dr. Batshaw has been a PI of NIH and Maternal Child Health Bureau grants for over 40 years and has directed a number of NIH consortia grants, including a 16-site rare disease clinical research network and intellectual and development disabilities research center at Hopkins, CHOP, and Children's National. He is one of 4 lead principal investigators for the HRSA-funded Pediatric Pandemic Network, and he'll provide a brief overview of the history regarding the development of the pandemic network. Dr. Batshaw?
Thank you, Charles. As physician-in-chief in 2020, it was March 15th when our first child was brought to the emergency room and diagnosed with COVID. March 15th, of course, is the Ides of March, the assassination of Caesar, and we could not see in front of us what was going to happen subsequently. But within 6 months, it became clear that this was a pandemic and that the primary focus was going to be on adults, especially older adults. And yet at the same time, we were seeing children developing this new syndrome of MIS-C, and we had a real concern at Children's National about what could be done to better prepare and better treat these children. And so we thought about our role in advocacy and policy being located in the nation's capital. And I went to Maternal and Child Health Bureau and had an audience with the leadership there and presented the issue and our ideas of what could be done to prepare better for future pandemics and what we could do now for COVID. And there was a lot of excitement from MCHB about this. And they said, but of course, you know, our budget is already set. And if you can find additional money, then we can do something about this. And so, again, being in Washington, we at Children's National decided to pull together a group of other children's hospitals that came from states where there was bipartisan representation. And through the leadership of Senator Murray in Washington and Senator Shelby in Alabama, we were able to get an appropriations to develop a pediatric pandemic network. And this all happened in relatively short order, so that, as Dr. Dixon noted, by September of 2021, basically less than a year after I had gone to MCHB, there was funding that was identified for the first grant given to develop the Pediatric Pandemic Network. And through further advocacy, we were able to get additional funding so that a second grant and now a total of 10 children's hospitals form the hub of the PPN, which the rest of the day we're going to be discussing. So the bottom line of all this is that the opportunity of advocacy to get the federal government to act in relatively short order is possible, especially when you have the coordination between, in this case, children's hospitals and HRSA in the form of MCHB. And I hope you'll find by the end of the day that this collaboration is starting to produce some very exciting opportunities. So thank you very much.